So now, after I've gone through all of the history, the S-bar, and I've done my medical thinking, I want to pretend like I'm in the room with Lucy and we're discussing these things. So here I go as I'm pretending to walk in and speak to Lucy. Hi, Lucy. My name's Megan. I am your registered nurse today, and I'm here to discuss some issues to help you better understand our health situation. So first, I really think that it's important that we address your dizziness. I did notice that your blood pressure is only a little elevated at 160/88. We do like to see blood pressure at the standard numbers of 120/80. So I'll discuss that with your physician about getting a cardiac physician in here to do a workup and any testing that might be needed. In addition, your heart rate's a little elevated at 102. And you've been requiring this oxygen through your nasal cannula that you don't typically use at home. Are you okay with that? Good. Yeah, it's better to go ahead and be better prepared than underprepared. I want to see from all angles. And then again, you also talked about your knees and the weakness. Do you feel like your knees are feeling prior to your knee replacement? Like maybe they need to take another look? Sure, better to be safe than sorry. So we can talk to the ortho physician just to come in and take a look, maybe get some imaging and see what's going on the inside and see if arthritis is flaring or if there's any other issues. I'll discuss that with your healthcare provider as well. Also, darling, I know that you are missing your partner. What an awful thing to have to go through that. I know that y'all depended upon each other. And that being said, it's obvious that you're in the grieving process. Are you open and willing to discuss your concerns with a mental health professional? They have many options for you if you would need a counselor. We can do this in an outpatient setting, or you can go into a physician's office. And there's many options for telemedicine now where you can do these things from the comfort of your own home. Great, I'm glad you're willing to do so. Now, let's discuss your living situation. You made it clear that you're all by yourself, and it seems like maybe you're a little bit lonely. I understand you like your visitors, but they're few and far between? Sure. So there's options to maybe make you feel not so lonely. There's home health care professionals that can come into your home, help you with tasks around the house or getting to the grocery store. There's other adult services such as Meals on Wheels if you're having difficulty preparing meals for just one person. It's a hard thing to get used to, right? Sure. And there's also even further, if you don't want to live in that house by yourself, we could put in a referral for assisted living facilities that you could qualify for, and you would sell your home and live in an apartment with other like-minded other senior citizens that you could spend your time with. And they have activities, there's a way to get a physician on the line, there's nurses there. Might be something just to consider, and as a different solution to home health care. I would just like to see you have more interaction with other folks. You're okay with that? Wonderful. I'll discuss this with your healthcare provider and we'll see what the next steps are.